I'm Nick Ferran. I'm a consultant trauma and orthopedic surgeon specializing in shoulder and elbow surgery. I'm passionate about delivering awake shoulder and elbow surgery under regional anesthesia where appropriate, and have interests in treating conditions such as frozen shoulder, rotator cuff tears, fractures and dislocations around the clavicle, shoulder, and elbow, and nerve problems such as cubital tunnel syndrome and carpal tunnel syndrome. If you have any of these problems or want a consultation about your shoulder or elbow, please get in touch with our practice management team. Patients come to see me for a variety of reasons with pain around the elbow. Pain can be on the outside of the elbow, on the inside of the elbow, and the back of the elbow. But sometimes the pain can be during elbow movement. Some of the common conditions I see include tennis elbow, golfer's elbow, loose bodies inside of the elbow, and degenerative change or early arthritis in the elbow. These often require a thorough history, physical examination, and an X-ray to help with the diagnosis. In some cases, we may need an MRI scan to help us confirm the diagnosis in order to develop a good treatment plan for the patient. So if you have concerns about pain in your elbow, get in touch with our practice management team so we can organize a consultation. Elbow arthritis can present in a number of ways. Early arthritis can involve loose bodies inside the joint, which can get trapped within the joint during movement and cause locking or clicking when the patient tries to move. In more severe cases, stiffness is usually the predominant feature, but although the elbow is stiff, the shoulder has such great movement it can compensate for a stiff elbow. So stiffness has to be quite severe to cause patients disability. In more severe cases, elbow arthritis can cause both pain and stiffness. The treatment for elbow arthritis depends on which of these problems the patient has. If the predominant problem is loose bodies causing jamming, clicking, locking of the joint, then keyhole surgery to remove the loose bodies will often alleviate the patient's symptoms and get them back to activity quite quickly. If the arthritis is early enough and the predominant feature is stiffness, we can use keyhole operation to remove the extra bone that is formed during the arthritis and allow the patient to regain activity. This allows them to get back to function, but can precipitate pain in the future when the arthritis progresses. In severe cases where the elbow is so arthritic that it causes pain and stiffness, an elbow replacement may be necessary. But elbow replacements are a pretty specialist operation done by a handful of people throughout the UK, so often patients would need an onward referral for this. If you think you have elbow arthritis, contact our practice management team and we can arrange a consultation for examination and investigations to work out what's the right treatment for you. If patients are having symptoms such as clicking, locking, or jamming when moving the elbow, this often requires surgery to remove the loose bodies within the joint that can be caused by arthritis that cause these clicking and jamming symptoms. This is a pretty quick procedure, can be often done awake under regional anesthesia, and patients can be back to activity very quickly with post-operative rehabilitation. If there's more severe restriction of movement due to the arthritis, then keyhole surgical removal of the extra bone formed by arthritis and releasing the tight capsular structures around the elbow can help patients regain activity in terms of range of motion. This procedure, it can be done awake, again through keyhole surgery, but needs aggressive post-op physiotherapy to prevent stiffness from recurring due to scarring. And patients could expect to start using the arm as soon as possible and hopefully be back to a full level of activity within about 3 months. As this is a degenerative process, however, they're always warned that their arthritis may deteriorate over time. So the benefits of surgery for arthritic procedures in terms of keyhole surgery may be short-lived, but this can be up to several years, buying patients important time to continue working and continue their recreational activities.